Data types. In general, whenever we are trying to learn any database or any software, first of all, we should have a minimum idea how that particular database or software will support different types of data. I mean to say, as we are trying to learn the SAS, we should have an idea how the SAS will behave with different types of data. That means how it will behave with the, as I said, we have SAS with data types. That means how the SAS will behave with the character, numerical, and date. And in this only, we have SAS windows. What are the different windows that we have in the SAS? And we have libraries, then input styles, then if and where, that means generally called as data controlling and variable controlling. That means here we will see if, where, keep, and drop. Okay. And later we have conditional programming, where we have if then else and select when, all that stuff. And we have conditions within the conditions, or regarding that we have do statement, and then we have logical programming where we will go with loops, conditional loops, arrays, and we have return statement, and we have first dot var and last dot var statement. Then we have merge, and then we will discuss about functions, formats, and SAS with data types, SAS with files. That means here we have proc export and import, and we have wizards, file and in-file statements, etc. Then we will start procedures, like first we will go with report writing procedures, where we have proc print, report, SQL, and we have analysis procedures, where we have proc frequency, means, tabulate, etc. And we have utility procedures, where we have proc append, proc copy, proc sort, etc. Okay. Then we will think about advanced programming, like proc SQL and then macros. Okay. Then we will go with the clinical domain. Okay. This is general SAS clinical content, but when it comes to the advanced level of clinical training, there we have information regarding SAP, protocol, and different organizations that are involved in drug development process and their roles and responsibilities, and clinical trial phases. Okay, and here we will think about different clinical study techniques like LOCF, BOCF, okay, baseline information, and we will think about CDISC, where we will go with the STTM tables, Atom, okay, and finally tables, listings, and figures, and validation of data, validation of program validation, report validation, log window validation, etc. Okay.
Okay.
So generally, when it comes to the clinical SAS clinical training, these are the general contents. But when it comes to the advanced, there we will think about these. Okay. So generally, it will be two different trainings. If you are looking for up to this level, most advanced level, that means if you want to know how to create STTM tables, how to create Atom data sets, and how to create tables, listings, and tables. Up to this level, if you are looking, then it is called as advanced level. Okay. So generally, this is a separate training, and up to this, okay, it is a separate training. So check out clinical trial process, describe the clinical research process phases, key roles, and key organizations, and interpreting an statistical analysis plan. That means what is SAP, what are annotated CRF, okay, and what are the regulatory principles that we have, like 21 CFR, Part 11, ICH guidelines, GCP, okay. Then clinical data structures.
So
like
all these what you are showing me, I don't know anything about this.
Okay, this is completely advanced level of clinical training. Okay, as you observe here, check out here we do have loops and arrays. Can you see them?
Yes.
Okay, and it is trying to say we do have functions also.
Okay.
So even though we are going with advanced, definitely I have to brush up them.
Okay.
Because directly if I show the program, you cannot follow unless you have basic knowledge of it.
Yeah.
We will go with them, and these are the contents that we have.
Okay.
Actually, if you are trying to write SAS clinical certification,
okay,
like just like base SAS certification and advanced certification, we do have clinical certification also. So these are the contents that we have in the clinical certification.
Okay.
Okay, you can have the same content even from the SAS official website. So these are the different things that we have in the training. So you are looking for this one, right?
Yes.
Okay. Okay. But remember that before we start, okay, at least we will be having 10 sessions regarding only the theoretical class. Because if you think about clinical research process, if you think about SAP, guidelines, okay, describe the structure and purpose of Atom data sets, all these are only theoretical.
Okay.
Okay. That means all that it needs is only explanation. So I will just show you the concerned PDF file and I will explain. But the actual programming will always begin, okay, from this particular topic, import and export clinical trial data. Of course, I will show you how we will prepare STTM and Atom data sets and how we will generate the report. At the ending, we will go with the project also.
Okay.
But I want to clear myself, okay. We have only explanation for at least 10 sessions.
Okay, yeah, I understand that.
Yeah, well, because you may thought that, okay, why Nandu has not started the programming, why he's just explaining all these things. So because
I understand. I totally understand this, and I am more for these kind of studies than the programming skills.
Okay.
Because programming, I can do it on my own. If you give me a program, I can understand it.
Yeah.
But I have to understand what is the data model, what are different, the HDT, and what is that? I have to understand that.
Yes. Okay. For that sake, I'm just letting you know. Okay. These are the things.
Okay.
So if you are interested to go with this one, then we will go with this one. But as I said, for first at least 10 sessions we have theoretical part, then we will start programming, but we will not go with base and advanced. But we will use them.
Okay.
Okay, we will use them. Okay, check out here also print contents and frequency. Those are general SAS procedures. SQL procedure is also there. So we will work with them. But regarding the SAS data, I mean to say clinical data, clinical study data.
Yes. That is exactly I'm looking for.
Okay, then for today let me give a small introduction regarding the clinical trials. Whenever we are trying to learn about the SAS, application of SAS in the clinical domain, first of all, we should have the idea regarding different terms that we have in the clinical domain. Okay, so here we have a glossary regarding the these terms. Okay, I will just forward you this particular document. You just go with it.
Okay.
It has given the entire list of keywords that we will get during the clinical study or clinical trial study.
Okay.
But in this, out of these, I will go with some of the important. Like adverse event. Adverse event means this is nothing but an unwanted reaction that was caused by the drug. We know that generally why we used to take the medicine, so that the medicine will work in our body and it will reduce the concerned problem or disease. That is the main cause to take the drug. But sometimes apart from reducing the concerned disease or problem, if it has raised any other complication, then it is nothing but an adverse reaction or adverse event.
Okay.
So in clinical study we used to have a table which is used to maintain all this adverse event related information. Okay. Like that we have ARM. ARM means a treatment group. Okay, within a trial we may conduct 2 or 3 different treatments. Each treatment group will be called as one ARM. And we have baseline measures. That means before we started giving our drug to the concerned subject, whatever may be the measurements that we have taken, all those measurements will be called as baseline measures. I mean to say, I'm suffering from headache or I'm suffering from a particular disease. So I have participated in the clinical trial. That concerned a researcher or the physician has given some medicine. So I'm using the particular medicine, and after 1 week again I have visited that particular clinical trial center. Now again they have taken my measurements. Now whether that particular medicine is working on me or not, how they will decide? By comparing the result with the values whatever they have before giving the drug. Actually I am suffering from so and so disease. At that particular stage I have different levels of BP, or I have different levels of blood composition is different at that particular moment. So after giving the medicine, okay, that medicine has to reduce those levels, isn't it? Whatever may be the composition that we have, it has to do some modification. So how they will check whether that medicine is working or not? By comparing our result with the baseline. Baseline means before giving the first dosage of the drug, whatever may be the measurements that they have taken, it will be called as baseline. So
and
they will compare.
It will be measured with the same patient, not a group of patients, right? The baseline measure will be different for.
They will maintain separate reports.
Okay.
Which you will see in the further sessions, because Conducting of trials is also different. We have parallel studies, crossover studies is there. Crossover means there we used to compare one treatment with another treatment to identify which one is better one.
Okay.
Like that we have randomized trials. We have different things which we will see in the later sessions. Okay. But generally baseline means before giving the first dosage of the drug, whatever may be the measurements that they have taken regarding a particular subject is nothing but baseline. Okay. That means basic information of the subject.
Okay.
Then we have bias. When prejudice lead to incorrect conclusions about the effects of the treatment, then it is called as bias. Generally, to overcome this particular problem, we have different techniques like randomization, blinding. Blinding means here the subject as well as the subject doesn't know what kind of treatment is going on. Suppose if you are the subject, if you are taking part in the clinical trial, you doesn't know what kind of treatment is going on. That means you don't know what was the chemical name of that particular compound, what was the chemical structure of that particular compound, all that information. Okay?
Okay.
If the researcher has hidden the information from the subject, then it is called as blinding. Sometimes we used to have double blind, where subject as well as the physician also doesn't know what kind of treatment is going on.
Okay.
All that they will do is they will give some pill and they will say to have that every day before or after meal. Okay. We don't know what was the actual composition of that particular pill. What was the things that will happen after taking that particular pill. All that we have to do is simply we have to use it. Okay. Both physician as well as subject also doesn't know that what kind of treatment is going on. Then it is called as double blinding. Like that we do have triple blinding, where subject, physician as well as third party. Third party means the person who is analyzing the data. That means we will also doesn't know what kind of treatment is going on. They will say some compound X, that's it. Okay, they will say compound Y, confidential. We don't know what is the actual composition of X or Y. Okay, but we will do the research on it. I mean to say, we will do the analysis on it. We will generate the reports and we will forward it to the concerned department. Okay, that is called as triple blind. Okay, like we have chronic
how
condition.
do the randomization done?
Pardon?
How do the randomization is done usually?
Randomization means here not a person or system will decide which treatment should be given to which group of people. It will be randomly decided.
Okay.
So that the researchers will have a broader idea, okay, on very huge amount of persons. Okay, that means not a person will decide, okay, for these people of this group of people give this particular medicine, for these group of people give this particular person. Like that, okay, nobody will decide. It will be randomly decided. Okay, so that they have a broader idea, okay, which treatment is effective on which particular group of people. Okay, it is one of the techniques. And we have chronic condition. Chronic condition means illness. Illness is called as a chronic condition. Crossover trial. Crossover trial means here they will interchange the treatment in between two different groups throughout the trial. Suppose if two trials are conducted, I mean to say two different treatments are conducted on two different group of people. At the beginning they have given some X on one particular group and they have given some Y on another particular group. They went for the research. After certain time they interchanged the treatment in between those two. Earlier somebody has taken X, now they have given Y to them. And earlier somebody has taken Y, now they will give X to them. They will interchange the treatment. And they will proceed in that way for certain period. Then again they will come to the normal. Like that throughout the trial, if they have interchanged the treatment in between two group of people, then that kind of study will be called as crossover studies. Generally, it is used to identify which treatment is better on which particular group of people. Okay, especially for comparisons, it is used.
Mm-hmm.
Data monitoring committee. Data monitoring committee means whenever a trial is conducted, okay, sometimes during the trial it may lead to some unexpected results, adverse event as I said. Sometimes we may have serious adverse event. By taking the medicine, somebody has died. So this data monitoring committee will always check over the trial and they will give the suggestions. Suppose if somebody has got severe problem after taking the medicine, they will suggest, okay, as we are getting some unexpected results using this particular chemical compound, it's better to suspend or it's better to stop the trial. Suppose if one treatment is better than another one, then they will suggest, okay, this treatment is better than that one, so stop that old treatment and proceed with the new one. Like that.
So
they will,
most of the trials will be, they will be monitoring the data throughout, not the end of the trial. They will be monitoring from the beginning itself.
yeah.
Okay.
It depends upon the design. It depends upon the design of the clinical trial. Okay. We used to have certain times analysis in the middle itself, and sometimes we used to have analysis at the ending completely.
Okay.
So it depends upon the design, how they have designed the trial. Okay, we have a document called protocol. Okay, in that particular document they will specify. We will see which all those things in the further coming sessions. Okay. So eligibility criteria. Eligibility criteria means this is a document which will help us or which will help the researchers to decide who can take part into the trial and who cannot take part into the trial. It is a combination of inclusion and exclusion criteria. Exclusion means it will give the guidelines to the researchers to decide who cannot take part in the trial. Generally, pregnant women are not allowed to take part into the trial. Why? Because it may affect the baby. Like that, if a person is already undergoing with the treatment, we will not take that particular person into our treatment. Okay? So, like that, it will give the guidelines, okay, who cannot take part into the trial. Like that, we have inclusion, where we have the guideline who can take part into the trial. Generally, certain trials are there with a specific age range. They will say a person must be in between 25 to 55. Only those persons should take part into the trial. Sometimes with a specific stage of illness, especially if you are going with the oncology studies or cancer research, okay, the person must be at the earliest stage of the disease. He may not be in the advanced stage. Like that,
Okay.
they used to give some specifications. Okay, regarding them, we will take only those guys to take part into the trial. Informed consent. It is a document where the subject will give his willingness to take part into the trial. Suppose if I am taking part into the trial, I have to sign a document where I will give a willingness. Okay, that too after listening to the complete, okay, advantages and disadvantages of the trial. Okay, but because all the trials may not give a positive result, sometimes it may give negative. So the subject has to participate in the trial voluntarily. Okay, he has to participate in the trial voluntarily. So that information will be maintained in the informed consent. Okay.
Okay.
Like we have Medical Research Council, MHRA, NIC. These are nothing but different organizations which are used to control medicine and healthcare products in different regions. Okay, and we have placebo. Placebo means it is a fake or dummy treatment. Here, we will not give any treatment to the subject, but we will act like we are giving treatment to the subject, so that we can study the psychological response of the subject. That means every day we are giving a pill, but
Okay.
actually the pill doesn't contain any
Medicine, okay.
Actual medicine. Okay, instead of that we are simply giving some glucose or something. Okay, but the patient will assume that he is receiving the treatment. Okay, so that we can study psychological response. Okay, principal investigator. Principal investigator is the authorized person under whose control the entire trials are conducted. Okay, he is the decision maker. Okay, whether if any decision has to be made, all that will be done by the principal investigator. And we have protocol. It is a document where we have the complete information regarding the trial. Complete clinical trial plan will be there in the protocol.
Okay.
That means what is the design, what is the study objective, what was the sample size, okay, what is the inclusion criteria, exclusion criteria, what are the statistical requirements that we should produce, how we will collect the data, how we will manage the data, how we will generate the reports, how we have to submit the reports.
So this is the document that will be most important for the programmer to understand the trial and what exactly they have to do, right?
Yes.
Okay.
But of course, for the SAS programmer, rather than the protocol, we have another document, SAP, Statistical Analysis Plan. That is, we are more concerned with it rather than the protocol. Generally, protocol is regarding the general, not analysis, complete information about the trial. But SAS is for analysis, so we are more concerned about the SAP.
Okay.
So these are the different terms. I will just send you the glossary. Okay, just go with it so that you will have an idea. I have just went with few of the terms, but in this particular document you have the complete information, complete recent terms. You just go with them, and if you are not able to understand any particular term, I will explain it tomorrow.
Can you send me?